I'm Dr. Angie, and in this video, I'm going to be answering pet parents' questions, or more specifically, cat parents' questions about inflammatory bowel disease. So let's get started. Claudia writes, my cat Stella suffers from IBD. She has had an ultrasound and blood test with an internist. She's on prednisone and an appetite stimulant and probiotics. I have tried Hill Science diet, high protein, no grain, freeze-dried, raw, and none have worked. The only food she eats right now is Fancy Feast, Natural Balance, high-protein chicken kibble, Gerber baby food, and canned no-sodium chicken breast. She can't be scoped because she's tiny. Any advice will be highly appreciated. Claudia, I'm so sorry you're going through this. My own cat has IBD, and I know how frustrating it is. I'm not sure why she can't be scoped. There must be something I don't know here, and maybe she just needs to gain weight. I'd be interested to know how long she's been on the prednisolone, and I'm glad you're working with an internist, because this is one time where I really feel like every cat with inflammatory bowel disease should have an internal medicine specialist on their team. It can take some time for them to gain weight, and I really would encourage you, when your internist feels like your cat's safe to be scoped, to get that done. I've definitely in my career seen a few cases where I wish I would have scoped them earlier. And then as far as getting your kitty to eat, I'm glad that she has something she can eat. I hope it's canned. It'd be better if it's canned. Royal Canin, I don't know if you've tried any of the Royal Canin GI diets, but I've had really good success with that. Blue Buffalo also makes a veterinary diet that's really palatable, so you might try that too. They make a GI diet, canned. My own kitty is on the Royal Canin High Energy, the GI High Energy, just because he was so small. I know what you mean, like they just kind of waste away, and so I can keep weight on him with that, and he does actually quite well. If the prednisolone isn't working over time, you could always talk to your internist about doing something like budesonide, but it's not uncommon for these really severe cases to start out with prednisolone or prednisone. If you try HempRx, it sometimes helps decrease inflammation. It can decrease nausea and help kitties feel better. I haven't had any severe cases of IBD where I've added on the HempRx and then the cat was able to come off of steroids. Usually it just helps their overall well-being. So let me know how it goes, and I'm so sorry you're in this boat. Lindsay writes, I have a 7-year-old kitty with probable IBD, and things have been pretty desperate lately. Mittens got sick last fall and has been on prednisolone since December. The prednisolone, sadly, has made Mittens diabetic. Oh, I'm so sorry. I'm working with my local vet here to taper Mittens off the pred, which I'm hoping to replace with HempRx, if we can get her diabetes into remission. Thorne's Gastroplex supplement, I'm not sure, maybe you're giving Thorne's Gastroplex supplement. How should I increase the HempRx dose while decreasing the pred? Should I increase the CBD while I decrease the pred? So I don't think that I would look at the CBD as a replacement for pred. If your kitty's sick enough to need steroids, you might consider switching over to budesonide, but not yet. What you want to do is try to get your cat into remission. So if you can taper off the pred, I would just start the CBD right now, and I'd start at a higher dose. I'd start with like 1 milligram per kilogram. If you send me an email, let me know how much your cat weighs. I don't think I have it here. I can help you calculate a dose. So just start it now, and then you can decrease the pred. I mean, you want to decrease the pred as fast as you can anyways, and then try the CBD. But you might need to put your kitty on something like budesonide. And I'm so sorry your cat got diabetes as a result of the steroids, and that is definitely a downside to using steroids in kitties. Let me know how it goes. Samantha writes, hello, my cat has IBD and gets depot shots. So that's an injectable steroid that lasts a long time, once a month since he's unpillable. But I would like to either reduce or eliminate these shots, but he doesn't like hemp oil, not even 1 drop. Yeah, kitties can be tricky like that. He won't take pill pockets. He won't eat food with hemp oil, not even Fortiflora. What else can be done for a cat who doesn't like CBD? I think at this point I would try the soft chews. Have you tried those? If your kitty doesn't like them, you can send them back to us. We'll take them back. But I think I would try that. The downside to the soft chews is they do have food ingredients. They're pretty broken down, but for really sensitive kitties, that can be a problem. The other thing that I might recommend to you is trying a mini melt. So Roadrunner, I think they're out of Arizona, is a compounding pharmacy, and they make prednisone or budesonide in mini melts. And so a lot of cats, like if you just give it with some food, they'll eat it and it just melts in their mouth. I think a really popular flavor is vanilla, which I think is kind of funny. I don't think of cats liking vanilla, but anyways, you could also try that out because your kitty's not the only one that's unpillable. Let me know how it goes. I think that's it. Those are all the IBD questions. If you have a question you'd like me to answer, you can reach me at Angie@BoulderHolisticVet.com, and I will talk to you soon.